I had these notes. I'm really excited. Why do we snore?
Yeah, that's a good question as well. So there's a few statistics, upwards of 50%, 57% of men, 40% of women, and up to 27% of children are affected by snoring.
My second son has snored his entire life, and we made him sleep with his older brother, who has hated it his entire life.
Oh man. Yeah. Yeah. And then something that we'll get to, it's like, unless you have somebody in your room with you, a sibling or your sleeping partner, and you're snoring, you'll never know. And it's not always indicative of a bigger problem, but as we'll discuss, it certainly is a factor in terms of making sure that everything's good.
So what are the common reasons for snoring?
So,
I mean, having a stopped up nose,
yes,
because you're sick.
As far as even just the shape of your body, let's say, if you're somebody, whether you're of normal weight or not, having a larger neck or having larger musculature in the neck or in the throat, that could play a role. That's a whole kind of like separate category as far as the shaping and such that can make somebody more susceptible to snoring.
So it could just be genetic. You're just built that way.
Definitely.
It could be that you're a bodybuilder and have massive amounts of, like, so The Rock probably snores.
I would hedge my bet and say, yeah.
Yeah. And then if you're overweight,
yes,
especially significantly overweight, there's extra weight on your neck, and that can affect it.
Yes. That's a huge part. Alcohol can play a role. So chronic drinking, chronic nasal congestion, sedative medications, and then back to sort of the physiologic component, you might have larger tonsils. Your tongue size plays a role. It can be literally obstructing, sort of your normal airflow. Someone might have a deviated septum. There's nasal polyps. Your jaw placement. I mean, there's a ton of things. Like you said, family history. If you never sleep on your side, always on your back. There's, sleep is.
So it sounds like there's kind of, I mean, I'm just going to go out on a limb here. Are there different types of snoring based on what is happening? Like if your tongue is big versus if you have massive tonsils versus if you're Dwayne Johnson?
So that's a good question. So ultimately what would happen, because I wondered this myself, because I'm planning on getting a sleep study. So a lot of this kind of hits home, at least at this moment. So
we'll check back.
Yeah. So yes, but hopefully the sleep study or the individual that you're working with can indicate kind of maybe what's the main culprit, because then that will dictate what kind of treatment, so to speak, that you would require. So if you need, we'll talk maybe a little bit about positive airway pressure via, a CPAP machine or an APAP machine.
Yeah. Yeah.
If it's just actually, I'm not even going to go there. You may require that, or they even have dental appliances now. So if you are somebody that has a jaw or tonsils or something, just at the level of your mouth that is contributing to this, they now have other means of treating that besides just like the loud machines that everybody sort of is accustomed to. So yes, that's a huge part, but it's hard to say how exactly you get there. You will have to rely on kind of the results of your sleep study. But it would certainly help if your partner tells you you're snoring, it's your nose, it's your this, that sort of information could help the diagnosis.
My wife has told me that periodically she'll wake up from snoring, me snoring, not her, and she'll just tell me to roll over, and apparently I'm very obedient in my sleep, so I do, and it stops. So I guess that's a good thing, but there are folks that
when you're on your side?
No, I'm on my back.
Well, whenever you move to your side, it helps?
Yes.
Yeah, and then so
it's because I'm jacked.
I'm a back sleeper too.
It's because I'm me and Dwayne Johnson.
So I guess, if we even back up just a half a step, what is actually happening when you snore? So obviously when you're sleeping, you are relaxed. Your body is generally relaxed. And so the musculature of your neck and your throat, all of those relax as well. So almost kind of like that collapsing of that, maybe for the lack of a better term. And then the rattling that occurs as you inhale and exhale.
Yeah.
Sound kind of bouncing off the soft palate, all of that.
Yeah.
All of that sort of stuff is what's contributing to the actual like audible sound that somebody's hearing.
Got it. Okay.
So the rattling and the vibration is ultimately what's, kind of causing the noise.
Fascinating. So if you or someone you love snores quite a bit, they should go get a sleep study and try and get it taken care of?
Sure. I mean, that's one part of it. And I think we can eventually get to some of that. Definitely. Because we mentioned in another discussion the stop bang questionnaire, which is a validated questionnaire that will help determine whether you are maybe a candidate for a sleep study. And the very first question, or the very first letter, S, in stop bang stands for snoring. So it's not the end all be all, but it's, it's a strike against you or for you in that case, in terms of determining what the next steps are.
Makes sense.
So it is very important, but not always sleep apnea.